This is the second lecture for RN 205. So we're talking about growth and development. So during the first year, what we want to see in growth is that posterior fontanelle should close by 6 to 8 weeks. However, the anterior one stays open until at least 12 months, 12 to 18 months, and that is an important assessment piece. If it's depressed, it's a sign that the child's dehydrated. If it's bulging, it's a sign that we have increased intracranial pressure. Weight, we like a weight gain of 5 to 7 ounces per week. So that's roughly an ounce a day. And if you remember your conversion, that's about an ounce is 30 grams, right? So 150 to 210 grams. That's during the first 6 months, and then growth slows down after that. For length, we want to see them grow about an inch a month, and for me this is easier numbers to remember if I keep it in ounces and inches, even though that's not what we usually use at the hospital. And that inch is about 2.5 centimeters. And again, this is during the first 6 months, and then it will slow down after that. Head circumference should grow about 1.5 centimeters per month, so that's a little more than a half an inch. Again, just in those first 6 months. Birth weight should double by 5 months and triple by a year. I think on average most babies double about 4 months, but where we are kind of looking at a concern is if they go more than 5 months without doubling their birth weight. Their birth length increases by about 50% in that first year. So if they were born at 20 inches long, we expect them to gain 10 more and be 30 inches long. And on average, 6 to 8 teeth in the first year, although there's huge variation in that. So, what we're looking at as far as development, so remember this is more skills, is by 1 month, the baby still has head lag and has that grasp reflex. By 2 months, if they're put on their tummy for some tummy time, they can lift their head up and they're able to open their hand, right? They tend to keep everything flexed when they're born, and so now you see them opening their hands some. By 3 months, head lag is getting a lot less. It actually should be gone by 4 months, but minimal at 3 months. They not only can lift their head now, but their heads and their shoulders, and they should be losing those newborn reflexes. So the grasp reflex is gone. If you put your hand in your finger in their palm, they don't automatically grasp it. 4 months, they can roll towards their side. If they're down on their back, they can kind of roll over onto the side, and they start grabbing things and putting them into their mouths. By 5 months now, they can roll from their tummy onto their back, but they get stuck there. They're like a turtle. They can't go the other way. And they can pick things up, but they're going to put their whole hand down on it. So a palmar grasp. They're kind of picking it up with their whole hand, with the palm. 6 months roll. Now they can finally roll from the back to the front, and they can hold on to something like a bottle. 7 months, if you hold them up, they can hold their weight on their legs. They can't balance, but they can hold their weight, and they can transfer from one hand to the other hand. So crossing midline, that's actually a far more difficult skill than it sounds like. So up till now, you put something in one hand, it's stuck in that hand. So they can finally cross midline with something. So 8 months, sit without support, and starting to use a pincer grasp, which the pincer grasp is using the thumb and the index finger to pick things up. So they're not quite there, but they're starting to use their fingers, not just that whole hand. 9 months, they can pull themselves up to standing, crawl on their hands and knees, and use that pincer grasp. 10 months, they can change from prone to sitting. And remember, they can roll well, so they can get themselves onto their tummy and then kind of push themselves up into a sitting position. And they can grasp something with a handle, like a rattle with a handle. 11 months, cruising, walking along, holding on to things. And they can put something into a container. So this is like your shape sorter toys, or the developmental tests often have a little jar and it's putting raisins into the jar. And that takes that good pincer grasp. So the thumb and the index finger together to pick things up. 12 months, if they're standing, they don't just fall down, but they can sit themselves down, and they can start trying to stack blocks. So build just 2 blocks, but they may not get it on there straight enough to stay, but they're trying. So here's pictures of head lag, and 4 months where we no longer have the head lag. Here's holding their weight up, but you can see he's not balanced, but he can do it. See how he's using his fingers, but it's not a true pincer grasp yet. So our developmental theorists we're going to look at, we're going to start with Erikson's. Erikson's 0 to 1, he says, is trust versus mistrust. 1 to 3, autonomy versus shame and doubt. 3 to 6, initiative versus guilt. 6 to 12, industry versus inferiority. And 13 to 18, identity versus role confusion. So that trust, the infant learns to trust their caregiver by having their needs met. So what we want to encourage parents to do in that first year of life is meet their child's needs. Then they start trying to do things on their own. So we want people to let them have those opportunities, whether it's trying to dress themselves or feed themselves. They don't do a very good job at it, right? They end up with food all over their face or their clothes on backwards and inside out, but letting them try and do some things on their own. Then after that, we have that where they're initiating things. So it's not just dress themselves, but they're actually wanting to step away from the parents and do things on their own. So this is our preschoolers. They love imaginative play and pretend play. They'll copy what they see, whether that's, building or being a doctor, and they love dress up and pretend and those sorts of things. They do not have a very clear differentiation between reality and pretend. So sometimes that's confusing for them. If you put on a princess dress, maybe you are a princess. And then we get to school-age kids. Erikson says they are ready to be doers and producers. So this is the age where they are involved in lots of things, and they are so proud of the things they're learning, whether that's school successes, musical instruments, sports. They're proud of all of it. So ask your kids, what they're doing, what they're enjoying, what they're learning, because they're learning lots and doing lots during the school age years. And then we get to our teens, where peers really become important. And Erikson says they're figuring out who they are, who they're going to be, what their place is in the world. And, and that's a pretty daunting task, and it's hard for parents to let go as well. So it tends to be an age where they often have some conflict with the parents. So our next theorist is Piaget, and he divides things up slightly differently with his ages. But initially, and Piaget is cognitive development, so those cognitive skills, where Erikson's was psychosocial, so it's more interaction with others. So Piaget does 0 to 24 months. He calls this sensory motor because they use their senses, right? Touching it, biting on it, throwing it. What sound does it make? What does it feel like? What does it taste like? That's how they learn. a really important thing they need to learn during that first year of life is object permanence. A young infant, if something falls, it's gone. They don't look for it. They don't know it's still there. It's not till around 9 months that they develop object permanence, which means they drop it and then they look to make sure it's still there. And they'll do that over and over and over. And partly it's a fun game to them, but partly they're reinforcing this idea of object permanence, that even though I can't see it, it didn't go away. And then he has 2 to 7 as the preoperational stage. And he says for kids here, they're very egocentric. That's not egotistical, it's egocentric. They cannot see things except from their own perspective. And they have magical thinking. If you think it, it might happen. And that can be both a good and a bad thing. Because if I got mad at my little brother and wanted him to go away and then he went to the hospital, I may have caused that because I wanted it to happen. So it's also why when you put on a princess dress, you might be a princess. So it both is a really fun thing at that age, but we've got to make sure that it doesn't turn into a negative. So that's between 2 and 7, but then he further divides it where 2 to 4, they're preconceptual. So symbolic thinking, they're starting to understand categories a little bit, but they're not very good at it. Like anything that's furry, they might call a cat, including horses and cows, and it has fur, so it's a cat. They use their imagination and they do that imitation, particularly imitating their caregivers. And then in that same preoperational stage, 4 to 7, we now have intuitive thought, and this is where they're better at classifying. So it's not just everything with fur is a cow or a cat, but they're classifying by much finer categories. And this is an age where they love to collect. So maybe they start collecting baseball cards, and they classify, these are my rookie cards, these are my Dodger cards, these are my Red Sox cards. They're making those classifications, and they love doing that collection at this age. Developing conservation. This is an important skill. Up till now, they thought there was more juice in the tall, thin glass than in the short, fat glass. Towards the end of this, around 7, they start realizing the same amount of juice can look different in 2 different glasses. Or 5 bills, if they're all $1 bills, is the same thing as a $5 bill. Where earlier it was like, wow, I have so much money, even though it's all ones. They didn't understand that more does not necessarily mean it's worth more. And then we move on to concrete operations. This is 7 to 11-year-olds. They can finally now put themselves in another's point of view. They can understand what somebody else was thinking or feeling. So they can understand the intent behind the action. Maybe somebody came over and broke their toy, but they can understand it wasn't done on purpose. It was an accident. Prior to this, they really can't understand that. They just see the outcome, that the toy broke. They can start to use logic, but it has to be concrete, not abstract. They can't think about things like, personal freedom versus societal needs and restraints. But they can be logical, but in a concrete way. And then after 11, so going into the teen years, now they can finally think abstractly, which is those things like, how do you balance personal freedom with the things that are beneficial or maintain society? So we've just got some pictures here showing those different things: the infant interacting with the environment, the child using symbolism, using that teddy bear, the older child learning conservation, and then the teen thinking about the future. That's another thing teens can do, is they can start setting goals, making plans, dreaming about what their life will be in the future. Here's learning through the senses. Those toddlers with the magical thinking, it's also toilet training time. Preschoolers who ask why over and over and over. School age, learning that conservation.